Hemochromatosis. A story was printed in the medical journal The Lancet in 1979 about a man who set off an airport security alarm even though he had no metal objects on him. It was discovered that the man was a patient who had blood iron levels 20 times higher than normal because he received blood transfusions regularly as a treatment. He had iron overload. The human body has no way to excrete excess iron. Untreated iron overload can lead to organ damage and death. Hemochromatosis, a disease of iron overload. Excess iron levels in blood. The body has no way of expelling excess iron. When it absorbs too much iron over long periods of time, often years, the excess iron builds up in organ tissues, frequently liver, heart, and pancreas. Symptoms of mild hemochromatosis include fatigue, weakness, joint pain, especially in the fingers, weight loss, and abdominal pain, especially near the liver. These symptoms are general, so they might be ignored. Damage from untreated or severe hemochromatosis could lead to liver disease, fibrosis, cirrhosis, cancer, heart disease, diabetes, arthritis, erectile dysfunction, and possible death. Diagnosis of hemochromatosis. The standard method of diagnosis is using the serum ferrum blood test that measures iron levels in the blood. Blood tests are the least expensive and the least invasive methods of diagnosis. Some medical professions state that the blood test does not give an accurate reading of the true iron levels, which is dangerous considering the damage overload can do. They recommend using MRIs to scan for iron deposits. Liver biopsies are another method of diagnosis, but are most invasive and expensive. They're used when the situation requires it. Two types, primary and secondary hemochromatosis. Primary and secondary hemochromatosis have the same symptoms, risk of damage to organ systems, and methods of diagnosis, but they have different causes and treatment methods. First, we will look at primary hemochromatosis because it is the more prevalent form. Symptoms, diagnosis, and possible other diseases caused by untreated hemochromatosis, already stated in previous slides. Cause of iron overload is a genetic defect, the most commonly identified genetic disorder in Caucasians, prevalent in Northern European populations and descendants, Ireland, Norway, Sweden, Denmark, Finland, Iceland, the United States, Canada, and Australia. Underdiagnosed can have hemochromatosis and show no symptoms because damage takes a long time to occur. Screening for family members of someone diagnosed with primary hemochromatosis is very important. If diagnosed, very easily treated with phlebotomy. Prevalence of genetic mutation is highest in Ireland. Diagnosis for primary hemochromatosis is essential because it is easily treated with scheduled phlebotomy sessions to remove excess iron from the blood. With diagnosis before damage occurs and treatment, a person can live a healthy life. On slide 4, it mentions that some professionals do not think that blood tests give the best accuracy of iron levels in the blood. Another article by Beaton and Adams describes a study where 50 samples of biopsy livers were examined for iron levels. The blood test reported that iron levels were not excess and showed no damage, but biopsies showed that 9 of those samples did have liver damage. 6 had fibrosis and 3 had cirrhosis. Beaton and Adams also suggested that scans like MRIs were better alternatives. The cause of secondary hemochromatosis is not genetic. It happens because of other circumstances in a patient's life. It is not limited to Northern European genetics. It can affect diverse populations. Treatment for it is not phlebotomy. This can be harmful. Treatment is iron chelating. Populations at risk for iron overload not caused by genetics are dialysis patients. They often have anemia because of kidney disease and receive iron replacement therapy. Iron overload is a risk of that therapy. Their iron levels must be watched very carefully. 2. People who drink more than 2 alcoholic drinks per day. This increases the risk of iron overload and can lead to fibrosis and cirrhosis of the liver over a long time. 3. Patients who receive transfusions on a regular basis because of anemias like sickle cell and Mediterranean anemia, thalassemia. Sickle cell anemia affects the African American population. Mediterranean anemia can affect African Americans, Asians, Mediterraneans, Middle Eastern, and Indian populations. Iron-induced liver disease is common cause of death in transfused patients. Treatment for secondary hemochromatosis cannot include phlebotomy. Drawing blood would undo the purpose of treating anemia. Patients are given iron because of anemia, but iron overload is a risk with this therapy. Iron levels must be watched very carefully in order to prevent iron overload. Instead of phlebotomy, iron chelating medications are used for treatment. Iron chelating is using medications that absorb excess iron and is then expelled through urination. Hemochromatosis. What can we do as students and professionals? Be aware. Know the diversity of populations at risk for hemochromatosis. Take care of your body. Avoid having more than 2 alcoholic drinks per day on a regular basis. Share. Knowledge is power. Many people don't know about iron overload and hemochromatosis. Questions. Which disease is hemochromatosis not capable of causing? 2. Primary hemochromatosis is most prevalent in which population? What 3 things can we do now that we know about hemochromatosis? Hemochromatosis is a disorder of. Secondary hemochromatosis is similar to primary hemochromatosis, except for. What is not a method to diagnose hemochromatosis? What is the treatment for primary hemochromatosis? Mediterranean anemia is another name for. Iron-induced liver disease is a common cause of death in blank patients. A man once set off an airport security alarm because he blank.